Hello, my name is Mohammed Siddiq and I'm a fifth year medical student currently at Brighton and Sussex Medical School, and I'm going to be talking to you about some findings of a systematic review, namely the risk factors and behaviours associated with acquisition of sexually transmitted Shigella in men who have sex with men. And this was a systematic review which I did earlier this year and is now published. The first risk factor identified was having a concomitant sexually transmitted infection or having a history of a sexually transmitted infection. And these MSM, men who have sex with men, when being tested for Shigella, they also presented with a concomitant STI such as chlamydia, gonorrhea, acute hepatitis C, and some of these tested also had a history of a sexually transmitted infection such as chlamydia, gonorrhea, syphilis, and genital ulcers caused by herpes simplex virus 1. The next risk factor is sexual behavior, and this includes behaviors such as unprotected oral anal contact, multiple sexual partners, unprotected anal sex, not always washing hands after sex in the last 2 weeks. Other sexual behaviors also included fisting, which was insertive and receptive, coprophilia, which is the practice of deriving sexual excitation from feces and its consumption, and attending sex parties and group sex sessions, and all of these facilitate the transmission of Shigella. The next risk factor includes HIV seroadaptive behavior, and this is essentially sero sorting, where HIV negative men will get with HIV negative men and HIV positive men likewise will get with HIV positive men, and this essentially optimizes transmission. In the context of HIV status, having a low CD4 count, a high plasma viral load, and not attending HIV clinic regularly to have these levels checked and to have symptoms checked were associated with Shigella. Chemsex, which is where substances such as mephedrone, crystal methamphetamine, GHB, GBL, Viagra, poppers, and marijuana were used during sexual intercourse, are associated with Shigella due to their disinhibition of sexual behaviors. The next risk factor is visiting sex venues such as saunas and sex clubs, which facilitate multiple sexual partners. And when these facilities were inspected, they had dim lighting, which prevented adequate cleaning, low levels of hygiene in the cleaning facilities, contaminated douching equipment, and inadequate contraception. And all of this leads to facilitated Shigella transmission. The next risk factor is geospatial mobile phone applications and websites, and it is these websites and mobile phone applications where the hosts of sex parties invited their attendees. They were also the source of chemsex drugs, and they facilitated the meeting of multiple sexual partners. The next risk factor is PrEP use for HIV, which increases the incidence of multiple sexual partners and increases the incidence also of unprotected oral anal contact. And finally, the last risk factor is living in an inner city region, which allows the formation of dense sexual networks, which also facilitates transmission. That's the end of the presentation on risk factors and behaviours associated with the acquisition of sexually transmitted Shigella in MSM. And thank you for listening. I hope you took something away from it.